We wanted to create a fun, non-judgmental space where women can talk about their shared experiences.
Here, we will normalize the challenges we face as females living in a society that dictates unrealistic and outdated expectations on what a woman should be.
Together, we hope to cultivate a supportive community of women who empower one another to courageously live unapologetically.
A quick disclaimer before we get started. Although Cindy and Danielle are licensed therapists, this podcast is not to be interpreted as therapy or a replacement of therapeutic services. It is strictly a conversation between two women about their experiences in the world. If you liked today's episode, please make sure to like and subscribe below. Also, follow us on all of our social media platforms at Unapologetically Females. With that being said, we hope you enjoy this episode. And we're back for another episode. Today I'm really excited. We're continuing with our Inspiring Women's series. I think this is our first Inspiring Women's of season 2 episode, right?
Yep.
Because we've decided we have seasons now.
Yes.
That's what we do. We just decide in the moment because we can do that.
Yeah.
So we say. So anyways.
Carte blanche.
Yeah. So would you like to introduce our guest today,
I
Cindy?
would love to. So this is Chelsea Crum, Dr. Crum. And Chelsea and I go back to college. She is not one of the 14 travelers, but she is a, what would we say? You have joined our pledge class in that way.
Yes, a pseudo.
A pseudo.
92er.
Pseudo 92er, but happy to be a 93er also.
Yes, yes.
Yes.
I'm lucky.
Very lucky. So Chelsea is a very well-known OB-GYN here in Scottsdale. And she and I go back to when we were growing up together and had a lot of very fun nights. I think.
I think.
I know. I do remember most of them. But what I love most about Chelsea is that, well, first of all, you are so down to earth, and she will never tell you that she is probably one of the smartest people I've ever met.
No, don't
But also one of the most talented singing voices I've ever heard.
Oh my gosh.
Oh, you're really airing everything.
This is fun. This is fun.
Yes. So fun fact about Dr. Crum is that before medical school, she moved to New York to audition on Broadway.
Which I never actually did.
Oh, well, but you moved there to do that.
I did.
And she absolutely could have if you...
Why? What happened?
I realized you'd have to kind of sell your soul.
Oh.
And that has to be the only thing in the world that you want, I think, to be successful. And I was applying to medical school, and that was kind of a for sure gig, and I chose that instead. So,
Wow.
She
I
was
mean,
sensible.
what a fun story, though.
Yeah.
but it was good. I grew up a lot
So when did you move to New York?
after undergrad,
Okay.
So
How long were you there?
almost a year. So in between undergrad and med school, I just worked as a waitress, and it was good. I
That was
needed
my
it.
dream.
Yeah.
Was to go to New York and make it.
Oh, well.
Was it
Yeah.
on Broadway
Anything.
in any capacity?
In show business.
Selling hot dogs on the corner.
Yeah,
Yeah,
could've
you were
totally
the
been
best
that girl.
hot dog vendor ever. Yes.
Yeah, I always wanted to go to New York. I never made it. I've been there on vacation, but did not,
Not
live
to
there.
live.
So did you live in the city and do
I
the
lived
whole
in
thing?
the West Village with a girl that I went to high school with, actually. And I would just walk everywhere, and it was great. I totally hung out with people that I would have never, ever hung out with in a bazillion years, and befriended like a kid from Bangladesh, and I would drag him with me to go visit all the sites, and I would teach him English.
Love it.
That's amazing.
Yeah, it was just like a totally different time in my life. It was really good. I grew up a lot.
Did you grow up singing?
Mm-hmm.
Like choir or in what capacity?
Mostly musical theater, or like at church, but mostly musical theater.
Okay.
Yeah, that was kind of my passion.
Do you ever sing anymore?
In the shower.
In the shower or karaoke after several cocktails. That's about it.
You do go to karaoke.
I was the wedding singer for many years when all of my friends were getting married.
Jump up on stage and have your solo.
Yeah.
What's your karaoke go-to song?
I don't.
Ooh,
God,
good
you know,
question.
I'm trying to branch out a lot, Danielle. try it because it used to be like Dixie Chicks, and
Yes.
now nobody knows who the Dixie Chicks are anymore.
They don't
so-
They're not
call
even. They
themselves
don't even
that.
call
The
themselves
chicks.
that. They don't know who they are
Yeah.
anymore.
So, yeah, I don't know. I've just sang some Cyndi Lauper
Yep.
a couple months ago.
good.
Yeah.
80s.
Yeah.
I love Sinead O'Connor.
That's a great
Nothing
one.
compares to you, but it's like
That's
such a
a-
long
that's-
song.
Yeah.
Yeah.
People might get bored with that.
Yeah, for sure.
So I had the pleasure of spending Chelsea's 50th with her in Punta Mita.
Yes,
This
it was
is
so
who I
fun.
went to Punta Mita with. But I believe that
Oh.
there was some singing, a little bit.
There may have been
Maybe.
This was just like
like a
2
month
months.
and a half ago.
Okay, in February.
Yep.
Yes.
Did you call me from there?
Probably. I don't remember.
Okay.
It was a good weekend.
It was a bit of a blur. Yeah.
Yeah,
But
in
it
the
was
best way.
wonderful.
It
Well,
was-
happy belated birthday.
Thank you.
How does it feel coming into a new decade?
You know what? I think life keeps getting better. With the exception of teenagers, I think life keeps getting better.
So Chelsea has a son and a daughter. How old is your oldest now?
19-year-old daughter in college and 17-year-old son in high school.
Okay. So you went to New York. I got so distracted with your showbiz career. We're gonna call it
Or
that.
lack thereof, but yeah.
I could just add,
Hey,
we could
it's
do
bigger than anyone that we will ever
I
have.
went to plays, that was about it. But yeah.
this. You are on Broadway.
Yes,
We're gonna say
literally,
it.
yes.
Okay, so you went to New York and then got into med school. Where did you go to med school?
U of A.
Okay, you came back to Tucson. And did you know I'm gonna go into the field that you were going into? Where did that start?
You know, my grandfather was a retired OB in Kansas City. And so I always would hear his stories and talk to him about it. And one time, I think I must have been in undergrad, and I was visiting, and I'm like, can I go see a baby being born? And he had already retired at that point, but he just like literally dropped me off at the labor and delivery. And it's like, here's my granddaughter, show her a good time. I'm like, oh my God.
How fun!
Just be standing in the back of rooms, like watching babies being born and watching C-sections. And I was like, this is pretty cool.
That didn't freak you out
So,
as a little kid.
no.
Yeah, so you were meant to be
Yeah,
a doctor.
that's amazing.
Yeah.
But I think I like, it's a happy field.
yeah.
Like it's 90% happy, 10% really crappy, but like it's happy. People are healthy. They're not sick when they're pregnant. They're healthy. You do get those sick patients, but I like the happiness of it. And then the fact that you get to follow them. I now have patients that I've had for almost, 19 years. That
Really?
still come to see me, and I get Christmas cards, and yeah, it's really, that's the part I love about it.
That's amazing.
That is cool
Yeah.
because, like, ER medicine or sports medicine or some of the ones where you come for an injury, you fix them
Yeah.
up and they're gone and you, may
don't
never see them again.
maintain a relationship with
Right,
them.
yeah.
They're consulting, and
Right.
like with me, I have had patients that were teenagers, and now I've delivered their kids, and it's just
Wow.
it's neat.
That's super cool.
Yeah, I love
How
that.
is it delivering their kid? It's like, oh man, I've been doing this a while.
Right? Yes.
Yeah, yeah,
Yes.
I get
and then
that
I think about my
sometimes.
old partner, and I'm like, oh my God, I'm turning into him. Because I'd be like, you're officially old. Like, you're delivering kids of your, and now I'm like, oh, I'm halfway there.
Yeah, no, I get it. I'll see kids that I taught in preschool, and they're now like getting married, and I'm like, oh my
Yes.
gosh.
Yeah.
Wow.
It's kind of weird.
Yeah.
So you went to med school. What's the tell me the path. How does that
4 years of med school, and then did residency, did that at Good Sam,
Okay.
now Banner University downtown.
Yep.
And then I got lucky and landed a pretty good gig in Scottsdale. And
Okay.
it just kind of fell into my lap. And one of my attendings called me and said, there's this group in Scottsdale that's looking for, a partner in like a year. And I was only a third year at the time. And I'm like, oh, I don't even know what to say. Like, okay, so I called up this attending who is like the guy that you go to for help with getting a job and the more real world type stuff. And he's like, okay, let's meet for coffee. And he's like, well, what's the group? And I told him like Newman and he's like, what? He's like, doot, 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 doot. Calls his friend. He's like, Rob, it's Mark. You guys are hiring? Well, she's sitting right in front of me. And that was it.
Wow.
That's awesome.
So have
And
you been-
19 years later.
That
Wow.
speaks volumes about you. I hope you know that.
Oh, well,
Yeah,
thank
it
you.
does.
I'm a hard worker.
Yeah.
But
you are.
but yeah, and I joined the best group, and I've been so fortunate, and I'm very aware of how lucky I am to be in the group that I am.
Wow.
Yeah.
That's really
Very
neat.
lucky.
I feel like that's rare for somebody to be from, have their career in essentially one location, from
And
start
she
to
grew up there.
retirement,
Yeah.
And she grew up in Arizona.
Yeah.
Okay.
Yeah,
Are you
as did
native
you.
to this?
Not native, but since 7th grade.
Okay.
Yeah. So my son goes to the high school that I went to. And yeah. So I knew I wanted to practice in Scottsdale and had offers other places, but I knew I wanted to be here. And I'm super lucky and have a great practice and very fortunate.
That's amazing.
Well, and your bedside manner is above and beyond, and that's huge. Especially like we really need to trust when you're having a baby. You really need to be able to trust your doctor, right? Like
Yeah.
and have a relationship with them that you know that you feel comfortable and
Yeah.
yeah.
I think so. It's a good fit for me.
Okay, let's get into vaginas.
Okay,
Okay,
yes.
like, that's-
I have so many questions, but I said to Danielle and I were talking about it, and I was like, okay, and she's like, you can't ask that, and I'm like, why not? And she's like, because she still sees patients,
Yeah,
and
yeah.
she can't like give up their nitty gritty.
Well, I can't say names, but
I'm like, what if
okay.
it's like, what if a vagina is identifiable? Like, what if you,
well, everybody always asks me that. Like,
if you're
what-
like, oh,
and
that's
I'm like,
Lucy.
once you look at like 20 a day, they all look the same. I mean, except for like, if I get graphic,
Yeah,
like
get graphic. That's what we
4 inches of hair or something, you're like, God, could you at least like trim that? Maybe just a little. But
So
you
have you
know,
ever seen a merkin?
no.
Excuse me?
Okay, a merkin.
That's so funny. We were talking about that on labor and delivery.
Okay, hold on. Definition, please.
A fake bush.
Fake bush. You like wear a yeah.
What?
Rita, you've never heard of a merkin?
I mean, it's bizarre. I don't know why anybody, because now the trend is definitely less hair.
It's a wig on your it's a wig
Why?
on your pink parts.
I don't know why
called a
anybody would want that.
I don't know
That
why
is
either.
wild.
yes.
Right.
I've never
I
seen
think
one.
that historically it started like back in the days where there was like where people had to shave because of cleanliness and bugs and things like that. And
Crabs.
so then, yes, this is getting gross. And then they would put these wigs over themselves.
The fact that you know the history
Yeah, it's
around
impressive,
this is.
Oh,
Cindy.
I've done the research.
She also wanted to know if you've seen a
Vajazzle.
vagina.
Is a vajazzle a real
I
thing?
said, if someone comes to the freaking
What is a
OB
vajazzle?
with their vagina
You do know. See,
bedazzled.
Rita knows what a vajazzle
Yeah, but like,
is.
why would you go to the doctor
A
and be like,
bedazzle.
"I'm here to get my pap. Let me show you my sequence on my vagina."
Well, maybe it's like an
you mean, like-
emergency thing and you weren't counting on it.
Like
Maybe
permanent jewelry or something
not
down there?
permanent. That I'm sure you've seen.
Yeah, I would, can't even imagine doing that. But
Yeah.
no, I
No,
have yet
no
to
vajazzle.
see a
Okay.
vajazzled vagina.
All right. Bleached buttholes?
I don't know that I would know.
Okay. So you don't look at the butthole.
How can you not?
I mean, it's right there.
Yeah.
But I mean, but like once again, I'm not like inspecting that area. If
not
I
putting
saw
back the
something like
curtains.
a big old hemorrhoid or something hanging out, I'll make note of it. But like, no.
Okay.
But I don't know that I would notice if it was bleached or not.
Fair. Okay.
I've never asked.
I mean, when
Do you bleach?
yeah, when it's like extra, like
Can you imagine? That might be. I might get like just like lose my medical license for saying stuff like that. I don't know.
you have a really nicely colored butthole.
Yes. Who does your bleaching?
That would be
No.
amazing.
Yeah. No.
Yeah.
Okay.
No, I found some interesting things in vaginas.
Oh,
in them.
Okay.
Yes. I think the craziest. This is such a good story because, and you may have heard it.
Oh.
But this patient comes in once. She's going through a divorce. She's got this new boyfriend. She's lovely, and she's like, I just have this
It's
smell.
not me, just to preface.
No, this was years ago.
That's not why I made
And
her heard it.
yeah, and so I'm like, well, let me take a look, and I look inside, and I'm like, well, you have like bills of some denomination in your
What?
vagina.
I definitely have not heard this one.
And so I like pull it out, and it's just, the smell is horrific, you know, and I pull it out, and there's $100 bill. And so I like put it to the side, and I'm like, well, let me see if there's more. And I go, and there's another. She had $200 in it for JJ. Yes. I was like, is this my tip? No, I'm just kidding. And she was mortified. I'm like, man, you guys are doing some kinky stuff in there. I don't know, with this new guy. And she was like dying laughing. She was so embarrassed. It was really funny. And I'm like, just put it in a little bag. I'm like, here's your $200.
Oh my gosh.
I
So
have
that's pretty
so
crazy.
many questions for her. But
Yeah, why? Like, why?
Yeah.
That is wild.
Yeah.
Wild.
Is that like, let's play ATM tonight?
Yeah. Or, like, what was the game?
Oh, okay.
Oh my gosh.
Enter the code. Beep, beep, beep.
Oh my
So
gosh.
weird. Yeah.
Credit card.
Okay.
Yeah.
In the
So
slot.
I'm curious. We'll get back. Cindy can't bounce back.
Sorry. Rita and I digress.
Okay, so from the beginning of your career till now, like the evolution of, I guess, what women like what has changed over the years, I guess, as you've practiced, most notable changes?
Well, I think, you know, when you start out, your patients tend to gravitate towards somebody their own age, I think, a little bit. And so I started out, and you build up your OB practice and a lot of young people, but now my patient population has aged with me. And now we're all kind of hitting the perimenopause years, and everybody wants to talk about hormones. And so, but I have seen that. Like, I didn't do hormones at all when I first got out. I didn't know anything about them. We just didn't learn much about it in residency. And now I feel like that's a big part of my practice.
Yeah.
So,
Do you do like pellets and stuff? You do?
yeah,
Okay.
I went and did like a special training. A few of us did, and got educated on all of that. I mean, you learn a little bit. I mean, obviously I know stuff about it, but not pellets. And I think it helps women.
Yeah.
Women
Yeah,
feel
I've heard.
better. And so that's been good. But that's probably been the biggest change. I mean, I still do probably 70% of my practice is obstetrics.
Okay. When has the average start time of beginning your menstrual cycle gotten younger and younger over the years? Have you?
I think historically, yes. But once again, I don't see that so much because
Sure.
they're kids.
Yeah.
And I
fair.
don't really see kids. So
At what age should you start going to a
gynecologist. You don't need pap smears until 21. But if I usually tell people, like, if you're having issues, like if your kid's having really heavy periods or something like
Or
that,
$100 bills stuck up there.
right?
Yeah.
or when they become sexually active, to get on birth control and to have open conversations about it, and so get them protected.
How old do you have to be to get like an IUD on your own? Is it 18?
Like if you go without a parent,
Mm-hmm.
it might be 18.
Yeah.
Yeah, it doesn't come up much because most of my kids come in with their
With parents.
Yeah.
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 Just wondered for those kids who can't talk to their parents about it.
And a lot of them will go to like Planned Parenthood or,
Yeah.
you know.
Yeah.
Mm-hmm.
And you can be under 18 for that.
I think you can.
Yeah.
Yeah. But yeah, I'm a huge IUD fan. Put one, not me personally, but my partner put one in my daughter before she went off to college. Not ready to be grandma yet.
Yeah.
Okay.
No. And she's not ready to be a mom, I'm sure.
No,
So, yeah.
no, that was a really unpleasant experience, though.
Yeah. Yeah.
She did not like me very much after that.
Oh no. Oh man.
Yeah, but now you can sleep at night, so.
Exactly.
Fair.
Yeah.
Fair.
Yeah.
That had to have been interesting, I guess. Maybe not in conversation, probably for her. I mean, for you, you're like, no, this is happening, and this is just matter of fact. And for her, it
I'm
probably
like, this
was.
will be good ultimately. I mean, she was on board. It was
Sure,
I was like,
right.
hold her down.
Right.
But yeah, she like vasovagaled, almost threw up. She threw up. They just like, I have to go to the bathroom. She was like running through my office. She yelled the F word like really loud. I'm like, oh my God. I'm like, sorry, everybody.
Oh my gosh.
She's mine. I claim her. And they're like, oh, that tracks.
Yeah, exactly. Exactly. Well, they've noticed that she was like this big in a Supergirl outfit, running around the office. So.
So it's probably actually really strange for them too to be inserting her IUD. Yeah.
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 My poor young new partner. I'm like, sorry.
You know her the least.
That's exactly why I put her with her.
So, okay, so you said hormones. Now that's kind of the stage of in your career with the population that you're seeing, a lot of conversation around that. What have you learned over the last few years? And like, I've learned about pellets recently, and there's so many conversations that I've had in my practice with women talking about how their mood fluctuates so significantly throughout the month, and and just how dysregulating it is, and how in session I have people that are just so hard on themselves because of their fluctuation in mood, and then they're like, I was on my period, or I was about to start, when they're reflecting on the month and then when things came up but then really, really hard on themselves of like, why am I this way? And why does it impact me like this? And
I see that a lot too. I'm glad you brought that up. Yeah.
And I think that people don't realize how common that is. Like, you're not, the outlier. Like I see more people than not that are experiencing that.
For sure. And I think it starts to hit like late 30s, early 40s. And that those PMS like mood type stuff just escalates.
I see it in young girls too in my practice.
Yeah, I mean, you can see it all the time.
Yeah.
But I never noticed much of a difference when I was young. But then as I aged, I was like, oh my God, what's
that
wrong?
Considered PMDD?
Yeah. I mean, I think there's levels, right? Like PMDD is more really severe type symptoms, whereas PMS is just more the general,
like crankiness.
Cranky, and then physical symptoms too. The bloating, the cramping,
For sure. For situations like that, do psychiatrists or doctors ever do an SSRI for 1 week? Have you ever heard of that?
Yes, and they say like do it for 2 weeks prior, like during the luteal phase of the cycle leading up to your period. But it never made sense to me because those medications take a couple weeks to really become effective.
Right, and their half-life is like 72 hours.
So to me, it never made sense. I'm like, if you're going to do it, just do it every day. And it's a pain in the butt to be like, okay, I got to start this on day 14. And, women, we got so much going on. Like, you don't have time to put it in. Like, just take it every day.
Yeah. Just put it in with those supplements.
Right.
Sorry.
And I think that there's two different ways you can really go about treating PMS, PMDD, and one is with like an SSRI and the other one is doing hormones. So something I've done more recently is starting people on progesterone and, in the luteal phase, and that just helps bring those levels up and can help with the physical and the emotional symptoms with fewer side effects.
Right.
Because SSRIs do have
Oh, yeah,
side effects
and they're hard to get regulated at first, too.
Yeah, they're hard to come on and off of. And so progesterone, I think, has really been helping my patients. And it helps you sleep. Which is a big issue as you age. I don't know if you guys have had that.
No, I sleep like a baby every night.
After you take like 18 supplements?
Sleepy time tea, melatonin.
She has a whole routine just to get to sleep. Yeah,
I know. My husband and I were like, oh my God, we're out of melatonin gummies last night. I'm like, oh no. And then we found some old, I'm like, we got these. We're okay.
They're all hard. And
I'm like, it's okay. Just chew really hard.
Oh my gosh. So perimenopause, I don't know if I just am hearing about it as much as I am now because I'm older, but I don't remember hearing about perimenopause so much until the last few years.
I think you're right, yeah.
So what, can you explain to us what is the definition of perimenopause? When do you know you're in it? What are the symptoms, of it? Like, and why do you think now we're taught, like,
I don't know why now it's getting so much attention and press, but and maybe it is just because we're at that age, or maybe you're not, you're younger, but where we notice it, people talking about it more. But I just think it's been kind of an underrepresented topic women's health in general,
Right.
has been underrepresented. And now there's really been more of a push to make people aware. But the perimenopause years can go on for years, like 4 or 5 years. And oftentimes cycles will start to change. Your periods can get closer together, maybe heavier before they start to space out. You can get more mood issues, bigger physical symptoms like ovulatory pain and pain before your periods. Those things just kind of escalate and get worse. Hormonally, like the definition of it is kind of hard. It's more of a vague time frame. I don't know that you can with a certain FSH level is definitive of perimenopause. It's just more like a time period and those symptoms.
Interesting.
So,
I mean, that's concerning for me because I've always had when I ovulate, I've always felt it. It's always been painful. I've had
Interesting.
yes, it's.
for some reason, after babies,
I
women feel
in my
it a
early
lot more.
20s, I felt it. Like I also had cysts too, ovarian cysts. But yeah, it's always been weird.
Do you feel like you have any perimenopause symptoms?
I mean,
You can't count your bad moods on perimenopause. I'm sorry.
Yes, you can.
you start.
Harper's over there like, yes, she has perimenopause.
I recently started on progesterone, so and at night,
Yeah.
and it does help me sleep better. But yeah, and so after my son, I got really weird. My period, it just went. I got COVID after him. Like, I don't know. I was 5 months when it was the first time I had COVID, and he was 5 months, and I got it really bad. And I don't know if there's research behind it at this point, but my period changed so much. Have you seen women where they felt that?
Yes, I find it to be more like it was immediate, like right during when they were sick with COVID or a couple months after. I don't know that COVID has been shown to forever change that.
Okay.
The timing is also
Interesting.
Right. In the fact that periods tend to get heavier and your cycles can change after a baby. So I don't know if you were breastfeeding or not, or you know how that all went down, but I would say most likely it was because you were postpartum.
So it was my first period, postpartum, COVID. It was like a fucking crime scene.
Yeah,
I
which
was
is very common.
It was. Don't have that recollection at all with my daughter. And so I was like, "What is?" And then I was dying. It was terrible. I was nursing, but then I ended up having to stop during that because there was a lot going on. But so it was crazy. I had never experienced what I had experienced.
That first one can be a doozy.
It was crazy. Well, then it didn't stop for I would get a period like every 10 to 12 days.
Oh, geez.
And it was like a crime scene every single time. So after, I want to say that was like August, September, and by December, I got an ablation.
Yeah.
And then she's like, yeah, hopefully this is going to stop your period altogether.
Didn't.
Nope.
But better.
Yes. So much, but I know, but I had high hopes
I know.
to never have a period again. But yeah, I way better. And it's fairly consistent now, but now it's like annoying. It's like super light. Like I spot for 2 days.
Me too with the Mirena. And I'm like super annoyed by it.
Yeah, me too. Me too.
When they say ablation, what does that mean? Because I think I've had that too.
It's where you burn the lining of the uterus.
So then no more bleeding because it's
Or
charred.
Hopefully a significant reduction.
Gotcha.
I think the amenorrhea rate, meaning like no periods, is probably like 50%, but 90% reduction.
Okay. Yeah. I mean, it definitely reduced it.
So it did its job.
It did its job. Yeah. I just was hopeful that it would end it. After you do that, so can people still get pregnant? I mean, I was told that in theory you should that would prevent pregnancy.
No.
But has that? I mean,
It is not a form of birth control, and there have been documented pregnancies after, and it's very bad.
Yeah, I was
Because
curious
now
about
you have all this scar tissue in there, and if there's a little patch of endometrium that an embryo can implant in, Now, where's the placenta going to implant? You have a very high risk of like a placenta accreta, just big, serious issues. So my preference is to have they have to have a permanent form of birth control on board. And if not, I counsel them extensively. Like, do not get, this could be life-threatening.
Wow.
Yeah.
Wow.
Yeah.
Yeah. Yeah.
So have your husband get a vasectomy.
Yes. So this just happened a few months ago. Fun story.
I can tell by the way she's leading into it that it's a fun story.
Well, I was late, and I'm like I'm anywhere 26 to 28 days, right? Is my cycle. Like, I am clockwork. I track it still because I want to know. January.
Okay.
And
Happy New Year.
and so I'm like, this is impossible. Like, what have I done in this lifetime to deserve this? Like, what did I do?
Meaning she thinks she's pregnant.
Yeah, because I'm like, I'm never late, and I'm telling my husband this, and he has a vasectomy.
Oh, okay.
And
Oh,
what?
So he's looking at you
I'm
like,
side eye.
Well, and I'm like,
the pool
you
man
never
and the
went back
gardener.
and got it tested 4 years ago after you were supposed to, so we don't know for like it's been 4 years. He's like, no. So yeah, I was, and then I'm like, well, and then I'm like, ablation, vasectomy. If I am pregnant,
it's immaculate
act of
conception.
God.
this is it's a punishment.
Yes, it's an act of God.
Because we are too old to be having a newborn. We're tired. Anyways, thank God. I mean, I was though to the point, like I was now 10 days late. That never happens. We were at the point where I'm like, I need to go get a pregnancy test. He's like, this is crazy. Thank God.
Then you got it.
And then I got
everything was good.
Yes, but that was very stressful.
It was probably just the stress of the holidays.
I think I was really stressed in January. Between that and changing, I was in the process of, I was in the interview process still of a new position that I'm now in. So it was like a long, stressful process.
So the therapist in me wants to say, Danielle, where was your self-care during that time?
Yeah, so cute.
Yeah.